All right, as people are coming in, I want to do a little bit of welcoming to welcome all of you that are joining us either for the first time, if this is the first time on this call, or even on multiple calls. I want to welcome you as someone interested in this intersection of Christianity and psychedelics, and today chaplaincy, and how chaplaincy is already emerging as an important role and entry point and discipline for bringing psychedelic healing and psychedelic spiritual experiences to all of us who are open and interested to that for whatever reason, as this moves along, as we begin to bring this on board for therapeutic uses, and then eventually we hope for spiritual growth and development as this moves along, as it'll unfold, already unfolding in the healthcare world, and certainly also with people with terminal illness. That's already starting to emerge too. So several places for chaplains to engage. We do have two of the leaders in the chaplaincy and psychedelics world, one who lives in the US and one who lives in Canada. And in just a minute, I'll introduce them and let them bring us up to date on the important work they are doing in their respective institutions and organizations. First, I want to just say a little bit about the role of chaplaincy. As I mentioned, it is emerging already as one of the most important places where the religious and spiritual world will intersect with the healing, mental health healing, addiction healing, healing from fear of dying, PTSD, and there are already studies underway, and Caroline and Jeff will be able to update us on that in just a minute. Before we begin, I do want us to take just a moment, maybe 30 seconds of some deep breaths and just a brief moment of silence for us to make the transition from whatever we were doing 10 minutes ago to what we're doing now, so we can all be present to the conversation and to each other and to what's emerging in this important field. So I invite you to get comfortable, get your feet on the ground if that's possible, depending on if you're sitting, where you're sitting, but just to relax your shoulders, to drop your shoulders, and to take a nice deep inhalation and exhale. Relax your eyes and our jaws, which are often clenched. To relax our faces, face muscles. One more nice deep inhalation and exhale. Hold silence here for just a few seconds. And all God's people said, amen. Thank you all. Thank you again for being present to this, for your interest in the conversation and the work that's happening at the intersection of religion and spirituality and psychedelics. It really feels like a big new frontier in all of that. And all of us on this call are on that frontier. So thank you for being part of that. Just a quick overview of Ligare, if you're just joining this call for the first time. We're a network of clergy and Christian lay leaders, researchers, medical and healthcare professionals, and funders and spiritual directors, all of us interested in this intersection and the work that's unfolding for all of that. And it's a collaborative network. It's all of us figuring this out together, sharing resources and making connections. And that's, I think, right now, the most important work that Ligare is doing is making connections with people, with information, and with each other, with the emerging research and all that's available already out there. There was a wonderful PBS show on last night that I'm pretty sure is available to just download and watch on the Nova program about psychedelic healing, an hour-long show, excellent. Some of the people we've heard from before at the research institutions, and some new people, and also some information about peyote, the Peyote Conservation Initiative in South Texas, and again, the research that's going on. So it's available for download. I live in Georgia, and I went on the Georgia Public Television website and watched it without being in front of the TV screen at 9 o'clock last night. So that is available, and I encourage you to watch that as an excellent overview about the healing that's coming, and it's already been documented in lots of research, both recently and then in the past, in the 40s and 50s and 60s. A statement about psychedelics. It's not a magic bullet. It is like any substance, there are dangers involved in that. And all of us that are moving into this space need to do our own discernment about how we engage it, if we engage it, when we engage it, in what setting. There's a lot of information already out there available for people that are discerning that. Ligare is not a place to come to find substances or even to connect in that way, but really here to provide information and network. But again, there's lots of information out there for all of us to do our own research and reading and discernment about how we might engage that now or in the future. We are developing resources for spiritual directors to be able to help prepare people for this and to integrate it after the experience. But primarily, we're about educating people about what's coming. So again, just to remind people that this is not a magic bullet. It's not a plaything. It's serious. These are serious substances that people need to go involved with, if you do, with eyes wide open. And also a statement about the church's role in keeping these really not available, probably for 1,000 years, or close to that anyway, at least in the Americas, with colonialism and the role of the church in that, and the really terribly fraught relationship with indigenous spiritual practices. Europeans discovered when they got to this country that people were using plants and substances for their own spiritual growth and development, and the church had a terrible role in persecuting people and killing people and punishing people. And we owe a great debt to the indigenous communities that have held these practices closely so that we now can engage them in a much friendlier context that we're in now of learning about the healing. So we wouldn't be here without the role of the indigenous communities in discovering these substances and then preserving them and using them in their own spiritual growth and development and healing. So that's something we need to keep front and center as well. I do want to make everyone aware of an emerging group, the Psychedelic Educators Network. We'll put a link to that in the chat, but it is people involved in higher education that are interested in, particularly those that are teaching and interested in connecting with colleagues and others. Will post that information. It's coming out of Missouri Western State University, Christine Zeimer, and we'll put information about that in the chat as well, with some other information as we move along. And so now I want to introduce my friends Jeff Vidt and Caroline Peacock, both colleagues in this work, but one in Canada and one in the US. We'll let Jeff introduce himself first, and we'll go to Caroline, who will introduce herself and then present where she sees this already and where she's seeing an emerging role for chaplains. And then we'll turn to Jeff, who's in Ottawa, to give us the view from there. But first, Jeff, if you just do a quick introduction of yourself and how you found yourself here.
Sure.
Yeah.
Great. Well, thank you. And I'm honored to be here talking with you today amongst friends and colleagues. My name is Jeff Vidt. I'm an ordained United Minister in the United Church of Christ, and I'm also a spiritual care provider that has been board certified both in APC and the Canadian Association for Spiritual Care. I serve on the board of the Canadian Association for Spiritual Care, and I've worked and trained as a spiritual care provider for my entire professional career in hospitals, long-term care centers, and other health contexts. So glad to be here with you today.
Yeah, thanks, Jeff. Thank you. Caroline?
Well, hi, everybody. It's great to be here. And I'm in Atlanta, Georgia. I'm at Emory University. I'm the Director of Spiritual Health for Winship Cancer Institute, which is the cancer treatment component of Emory Healthcare. By way of background, I'm an ACPE certified educator and a board certified chaplain, and I'm an Episcopal priest. And before I went to seminary, I worked as a licensed therapist, as an LCSW in New York City for a while. And then changed paths and went into the ministry. So I'll just kind of jump into my presentation then. So I fell into the world of psychedelics very unexpectedly. There was a trial that was going to be happening at Emory with demoralized palliative care patients. And the trial was being, the protocol was being written by a palliative care physician, and we've had a long relationship with the palliative care department. And he wanted to make sure to include spiritual health clinicians or chaplains. We sort of use those terms interchangeably in our context. He wanted to include spiritual health clinicians in the protocol because of the collaboration of our team within their clinic. And so I was asked to be one of the chaplains on that trial. And this was already a couple of years ago. And and the study actually still has not begun. And that's how long things take with the FDA. It's truly such a long process, but we're starting to recruit patients. So that's exciting. But what happened was I wanted to learn more about this world. And so I picked up Bill Richards' book, and I was totally amazed because it was the descriptions that he had in that book were the most familiar to my own spiritual life that I had ever experienced. So just reading these descriptions of psychedelic experience, I thought, I've never heard people talk like this. Like, this is what I maybe experience in my dream life, or even in some awake states at, times where I just kind of related it to my regular spiritual life or prayer practice or whatever. And so I thought, this has got to be, sacred and real. And so I wanted to learn more. So it led me into experiences of learning more about psychedelics, and I became aware of the healing power of psychedelics and of a sort of a deepening comfort with my own experience of my spirituality, which I hadn't really found in religious settings very much. And all of this, in the meantime, I was also entering a doctoral program at Candler, and so I decided to focus my research on the topic of chaplains and psychedelics. And so that's what I've been researching. I've been interviewing chaplains who are engaged in this work really around the world. Everyone who I've interviewed has been doing this work in legal contexts. And what I'm exploring is the experiences, the perspectives, and the functions of chaplains in psychedelic assisted therapy. Along with a friend and colleague, Dr. Jamie Beachy, who is a chaplain and ACPE certified educator. She works out at Naropa. She's on faculty at Naropa. She and I joined forces, and we pitched an idea to Transforming Chaplaincy, which is a sort of think tank around issues related to chaplaincy. And we asked if we could create a network for psychedelic care. And they said yes. And so we started that network almost a year ago. And we have been meeting and gathering chaplains and those interested in research. And what we do is we gather monthly, much like you all do here, and we talk about these topics. So now I'd like to talk a little bit about why I think chaplains are so uniquely suited for this work. And probably many of you know all this, but I'll just kind of run through it from my perspective. I believe that the skills of chaplains, listening, attending, warm-hearted presence, creating an allowing environment, supporting exploration, having a non-judgmental presence, meaning-making, crisis support, presence during pain, integration support, and understanding of spiritual and religious imagery are all part of the chaplain skill set. And those are things that are really important skills and ways of being within a psychedelic guiding experience. I also think that psychedelic experience is spiritual at its root. And as you all know in this network, many communities and cultures have been utilizing sacred medicine for millennia and already have this knowledge. I think that chaplains are trained in the art and science of accompanying people through what I would refer to as non-ordinary states, even outside of psychedelic medicine. So, for example, death experiences, crisis experiences, life-altering experiences. These are peak events in people's lives where there's just can be such intense experience. And that's what we do every single day. And so I think the skills that we have in those spaces can be applied, easily adapted to a psychedelic guiding experience. Some of the problems that exist are that professional organizations that support chaplains may be slow to understand about the work of psychedelic assisted therapy. And I don't think that this is in any way because of some intentional opposition. I think it's just, a lot of it is just about exposure and education. And so that's why I think we need to be doing a lot of advocacy around this. Also, a lot of other professionals, such as physicians and mental health professionals, who are the ones who are writing the protocols, who are engaged in the clinical trials, they may not understand our role, and they might disregard our role. They might see as primarily attending to people who are religious, for example, when truly what we do is much more expansive than that. So I think that, and there are also persons who have worked with psychedelic medicine in community settings, and I tend to use that term instead of underground settings, in community settings, but who might not have chaplain specific training or certification. So there are a lot of people who are doing this work in some contexts, but are not connected to professional chaplaincy. And on the flip side, there are people engaged in professional chaplaincy who might be able to learn from people who are doing this work in community settings. So I think that there can be some sort of cross-pollination in terms of education and information. So I think there needs to be a lot of collaboration and learning from one another. In terms of next steps, kind of looking towards the future of this work, I think that chaplains who are in healthcare settings can connect with the physicians and scientists who are writing these protocols, who are leading these clinical trials, so that they can become involved in the research. I think even outside of psychedelics, this is one of the problems with spiritual care or pastoral care departments in many healthcare environments. There tends to be a disconnection between these departments and the other disciplines. And when really we're all attending to the health and wellness of patients. So I think if chaplains and people leading these departments can reach out and create relationships with the scientists and the physicians who are leading these trials, then chaplains can be written into the protocols and become a part of the teams. As I mentioned, Jamie Beachy and I have this network, Transforming Chaplaincy Psychedelic Care Network, and I will put the link in the chat if anybody's interested in joining that network. That's a great place to come for education and for community. Finally, I think that folks who are interested in this work, but who might not have training in chaplaincy, I would want to encourage people to, do those CPE internships, do those CPE residencies, become board certified chaplains, so that people can gain really solid professional skills in chaplaincy prior to becoming a psychedelic chaplain, if that makes sense. And I think that same conversation is happening for a lot of therapists, that people might work to become qualified therapists with really solid skills before then becoming psychedelic therapists, because some of those core skills you want to have at your baseline. So I'll stop there. I've talked a lot, and I'm happy to answer any questions at whatever point makes sense.
Thank you, Caroline. I had a couple of questions too. We'll circle back around after, see if Jeff, how Jeff answered the conversation. But I'm interested in a little bit more detail about the study at Emory, if you're going to be able to talk a little bit about that. But we'll circle back around to that. All right, Jeff, calling in from Canada. Welcome. I think real quickly, one of the things that I'm aware of is even each state in this country, but certainly each nation. Canada's doing this a little bit differently. It's emerging a little bit differently up there, and even in Europe, there's a vibrant conversation there, but not so much in the religious or spiritual world. Still sort of clinical, but each region or part of the world is coming at this in different ways, and Canada's doing it uniquely. And I think Jeff's going to give us a good view of that on the front lines of that.
Well, yeah, let me just take a moment to say thank you to Caroline and to Hunt and all of Ligare just for the leadership and for the openness and for all of the work that you've been doing so far. This is a very fast moving field, and one that it's very easy for people who are interested to get kind of directed in ways that make them subject to the powers that be. But they've been very focused and very clear on what can make psychedelics helpful and healing to people that are out there. When I was thinking about what to bring to this group today, I wanted to take a little bit of time just to share a little bit of my own story. I don't do this with the intention of being prideful or assuage any part of my ego, but just to give you a sense of where someone who had never experienced psychedelics before came into this field, and how it might be healing before I get a little bit into the Christian context. I was raised in a very evangelical conservative household in Indiana. I did the whole 9 yards in school of doing the Just Say No programs, and was taught that every single illegal substance that was out there was kind of the same thing. Marijuana, heroin, LSD, they're all terribly bad. And even more than that, they're all sinful. And so if you use these drugs, you're going to end up in hell. So it was very strongly impressed upon me that everything that was in this category was very bad. And there was no drug use in my own immediate family, as far as I can tell. And we had a very strong legalistic mentality directing all of these decisions that were very morally based. Even more than that, I was taught in church that drugs that induced hallucinations, all of those visions and hallucinations were coming from a very bad and evil place, that they were at their very heart deceptive, and that using these drugs that opened up these visions were a way of being a gateway to demons that could come in and influence you. And even though it may feel good, or it might be a good thing initially, it's ultimately evil in its character, and so it can't ever lead to a positive outcome. At the same time, in our church, I was taught from a very young age that encounters with God were a very positive thing, that you sort of yearned to have an experience of God. But it was very limited as to what that definition was. I recall very clearly these popcorn testimony nights in church where people would stand up and say how they heard the voice of God, or felt the direction of God, or felt God guiding them in a certain way. And that was their way of saying that this was a good and holy thing. But I was told very clearly that God does not speak to us audibly. The only way that God speaks to us is through scripture. And so I was taught on one hand that you want to have these very clear and confident encounters with God. And that means that you're doing God's work and doing very holy things. But on the other hand, you have to be very discerning, and you have to be very suspicious of people who say that they're hearing the voice of God and doing God's work, because if it doesn't measure up, then it's probably deceptive. So I had developed a very healthy interest in mystical experiences, but also had a very narrow definition of what mystical experiences were. And it was around that time that I had a very dear friend of mine had a near-death experience and claimed that she had seen God. And she spoke very quietly, but very confidently about her own experiences. And that ingrained in me even more an interest in what would it mean, and how would I know when I encountered God. I went on to school intending to be a pastor and went to seminary, carrying this interest in mystical experiences, but never having experienced one myself. I learned in seminary all about the Christian founders who were desert mystics who would have days upon days of fasting and study, and would have mystical experiences, and how informative and how transformational it was to their sense of spirituality. But it was very foreign to me what these experiences were. I actually remember very clearly that in one of these classes that was dedicated entirely to the Christian mystics in seminary, it was a very small class. I went to Fuller Theological in California. There were only about 10 or 11 of us. And through the course, we were talking about how we received our call and how we experienced mysticism. And I learned through the other students being vulnerable that over half of that class had received their call to ministry through a drug-induced experience. That was very profound to me, and how this thing that I was taught was always evil and always impure and would never lead to good, somehow brought these people not only into Christianity but into the ministry. And they were very passionate, very Christ-following, and so that planted a seed in my mind that maybe much of what I understood in mystical experiences was not totally true. Went on to do chaplaincy training at the Cleveland Clinic in Cleveland, Ohio. I decided to leave the home church in which I was raised and became a United minister. But for much of this period, I felt a lot of distance from God, and I was experiencing a lot of suffering in the hospital. Many of you who are spiritual care providers can maybe resonate with the experiences that you encounter in the hospital. Can be very difficult. I worked on a pediatric floor, and so having to be in the room when parents were receiving difficult information, you carry that question of why God with you, and you don't have an answer. So I was experiencing a lot in that work that made it difficult to feel very spiritual. And it was around this time that I had heard a podcast on Radiolab about the Good Friday experiment, and how there were people now studying using psychedelic substances to elicit spiritual experiences and mystical experiences. And so on a whim, I wrote an email to the faculty at Johns Hopkins, who I knew were conducting a study on religious leaders, and was accepted into that program. So in 2018, I embarked upon a new journey where I used psilocybin in a controlled environment with two guides. My guides were Bill Richards and Claudia Turnbull. And I was able to experience for the first time being in the presence of God. And I won't go too much into that experience, just because I know it often feels like I'm just telling somebody what my dream was like. If you haven't experienced it, it's hard to really directly translate what that was like. But it was very transformational and very profound. And it was a very healing experience for me. And it was through that I got very interested in the use of psychedelics for spiritual healing and transformation, and have become very active in the Canadian context. Like I mentioned before, I'm a part of the board of the Canadian Association for Spiritual Care, and am working with different organizations up here to promote a spiritual perspective as they conduct research and care within healthcare context for psychedelic assisted psychotherapy. So what I would usually tell folks who are curious about psychedelics, as much as what has been said already, it's a very powerful thing, and something that can harm people as well as help. And I think the way we go about it and the relationships that we form in it can be just as powerful and transformational as the experiences themselves. I am very convinced that they can be healing. But I would stress that the healing does not happen from the substance themselves. It happens from the therapeutic relationship and the way we integrate the experiences that we have in that process. The context is everything. I foresee that a lot of people are going to pursue psychedelics as a treatment for what ails them. And I think religious leaders, and in particular spiritual care providers, have a responsibility to be in the room. I would say it's more than just an interest and more than just wanting to see how things go. I think we as spiritual care providers have a very unique and insightful and important perspective to provide, and one that needs to be in the room in order for people to experience this therapy in a healing way. So much of my work is about helping and guiding others to a sense of meaning and a sense of connectedness. And psychedelics does the same thing. Like Carolyn was saying, there's so much of our competencies as spiritual care providers that aligns directly with few exceptions to what they're saying should be psychedelic-assisted psychotherapists competencies. Canada is moving very quickly towards legalization of psychedelic-assisted psychotherapy. There have been many studies, and there is now a process in place called the Special Access Program, where patients can request psychedelics for the use of alleviating end-of-life distress, alleviating treatment-resistant depression, and for treatment for drug addiction. And those parameters are slowly being expanded. The federal government has even pre-approved research programs on psychedelics and psychedelic-assisted psychotherapy in those modalities. So there's a lot of interest from the government to see research on how this can help people. Alberta recently, just the other week, has expressed that they're going to legalize and provide a legal framework for psychedelic-assisted psychotherapy to take place in anticipation of the federal government legalizing it. So there's high interest in the models around how this care is provided. Pockets of trainings and research programs and hospitals are all in a race to develop their own model to see what would be most effective and most beneficial. And I would highly recommend that if you are a spiritual care provider in any of these contexts, do your best to be in the room. Let people know what it is that you provide. And I have found that in particular, physicians, psychiatrists, psychotherapists, they're actually very open to having you be involved because they understand that there is a very big spiritual component to this, and they don't know it. They don't know how to deal with it. And there was a conversation not long ago where a psychiatrist was presenting in front of his group that the spiritual component is going to be very important, and he was met with laughs and giggles, and he had to reemphasize, listen, folks, people are coming to us as spiritual creatures, and even if we don't believe it, it's going to have a dramatic impact on these experiences and how they're integrated, and that's where the healing is going to take place. So we need to be open to the spiritual healers that are out there. There's a lot of training programs, there's a lot of things that are being developed, and there's very little accountability yet. There's likely going to be some larger organizations that say, okay, these are the competencies, these are the training programs that are going to be certified, and this is what you'll need in order to be a psychedelic assisted psychotherapist or spiritual care provider. That isn't in place yet. Lots of conversations are happening. Even now, I would say maybe look towards those university programs or those schools or those institutions that are well established to provide the training that you're looking for. I know in Canada, the University of Ottawa is just starting a psychedelics and spirituality master's degree, headed up by Monica Williams and Anne Vallely, two big names in the field. That would be a good place to start. Different healthcare centers are doing certification programs in psychedelic assisted therapy and palliative care. Naropa has a great program. Emory, I think, is starting to develop a CPE program, if I'm not mistaken, and Carolyn will go into that a little bit more. These are places that that will be very integral as this field develops. I'd also say get connected with your conferences and your certifying organizations as spiritual care providers. As a part of our Canadian Association, we're working on putting together a position statement that says, you know, we support the spiritual dimensions of healing that take place in psychedelic assisted psychotherapy, and we also wish to emphasize the importance of connecting with Indigenous partners. So we, as spiritual care providers, have a responsibility to also put forth the cultural implications for indigeneity and reconciliation that take place. So feel like I've talked a lot too, so I want to open it up. I'm sure there's lots of questions out there, but again, thank you for your time.
Thank you, Jeff. That's really excellent, and you bring a lot of new information. I'm wondering if you could say a little bit about the Roots to Thrive. So
yeah, sorry, yes, I can do that. One of the big programs that's available here in Canada on the West Coast is called Roots to Thrive, and they've just formed a new partnership with MAPS Canada. And what they've been doing for a long time is working with Indigenous models of providing care in a psychedelic assisted psychotherapy group context. So it is community based, and what that means is that they come together as a group and live together for a significant period of time. And psychedelics is a part of it, but it's not the main part. And the transformation and the healing that takes place comes from the relationships that are formed. And the federal government has recognized this and sees this model as being one of the most transformational. And so they're specifically asking for research programs that are based on the Roots to Thrive model, alternative to the medicalization, to you sit in a chair, you get an IV, you have your experience, and you have 2 or 3 hours of conversation afterwards. Instead of it being something that is treated as though you have a diagnosis, this is the cure for your diagnosis, and then you leave and never experience anything about it ever again. It's, we understand people are coming into this care with a life, with a context that's unique to them, that gets transformed in part of this process. And so the healing that happens needs to be more than just razor focused on drug addiction or on mental health. It needs to encounter the whole person. And every spiritual care provider I've talked to has been excited by that idea. So hopefully we'll see more of it later on.
Thank you. And there's a lot of information available about them. But as you were talking, Jeff, I think that really can be a model for how eventually church communities or, you know, religious and spiritual groups could, I mean, in our core, we're a community, often big, but that's who we are too. And down the road, I feel like there'll be a role for church communities and spiritual groups to care for each other in that way as this moves along. And so Roots to Thrive is out on the front edge of that as a community-based model, and also eventually can lower the barriers to the cost. And I mean, you need to diagnose right now, you're going to need a diagnosis, you're going to need a lot of money, and who knows if insurance is going to cover it, and all those things that keep people from lots of things. But it's going to prevent people from accessing this in some cases. So finding new ways to do, or creative ways to do that. Thanks. And I know I encourage all of you to do a little bit of research on Roots to Thrive. Wonderful things about that. Caroline, if you could talk a little bit about the study maybe, or the project at Emory, and maybe the institute that you all are starting to, what's happening at Emory?
Yeah, sure. We have a few things happening at Emory. So we have a new Emory Center for Psychedelics and Spirituality. And this is a combined effort between the Spiritual Health Department and the Department of Psychiatry. So, you know, we have the Department of Psychiatry already had some clinical trials underway with patients with depression, both through MAPS and through Compass trials that were completely disconnected from spiritual health. And they did not have spiritual health folks engaged in those. And then there's also this other part with spiritual health and palliative care, where we did have spiritual health. Now we're combining efforts because we really recognize that this collaborative effort between the mental health practitioners and the spiritual health practitioners are so valuable in the psychedelic assisted therapy experience. So what we've been talking about is a triad model where there is a mental health clinician and a spiritual health clinician. And then the third part of that triad is the patient, who is utilizing their inner healing intelligence to be a part of the treatment modality. So that's what we're sort of talking a lot about with our new Center for Psychedelics and Spirituality. And we have an event happening on April 1st that will be both in person and also live streamed for folks who are interested in learning more about the work that's happening here. But I think all of this is happening because of these nurturing of relationships, and because that within our medical context, there's a real appreciation for the value of chaplains and the value of spiritual health. So our department has existed for several decades, and because of that, these relationships have formed over time. So it's a really exciting time.
Mm-hmm.
Yeah, it really is. What about the study? Any thing that you could share about that? Sort of just the who.
Well, the study is with palliative care patients who are experiencing demoralization. We're very intentionally recruiting a wide variety of patients from different racial and ethnic backgrounds. That's a real value of our center. And patients experiencing demoralization fall into this category of, it's just a very hard condition to treat. When people are maybe have a terminal diagnosis, but are just, or even they might not have a terminal diagnosis. They might simply be receiving palliative care support, but they're feeling so overwhelmed with life and just having a hard time putting one foot in front of the other. These are the sorts of patients that we're recruiting for the study, and that we'll be providing this triad model of care, and hoping that we can provide some relief to these folks.
Mm.
One of the things that came up on that PBS show, the Nova show, was about cancer diagnosis. It was about cancer, and
these are all cancer patients also.
And it said that so many people, I can't remember the percentage, but a high percentage of people who get a serious cancer diagnosis experience depression. But because the cancer treatment takes priority, and that's where the energy and the focus is, that the depression is sort of secondary in the treatment, but not secondary in the lived experience, that it's probably primary. And that one of the things that's shifting is cancer treatment centers are beginning to take more and more seriously the role of a better mental health and healing. Mm-hmm. And somehow in the midst of all this, that if people could, if they lower their anxiety and lower their depression, that the healing potential is even greater.
So, and there's a Canadian connection, but I know James has his hand up, so let's give James the opportunity.
Yeah, James.
Thanks. Yeah, I'm really just resonating with this conversation, and it's more a comment than a question, but I'm excited. I had coffee a couple days ago with a friend of mine who's a student at the Seattle School of Theology and Psychology out here in Seattle, and we got talking about, in the world of therapy training, internships, and how, the internship model where, a up and coming practitioner is being supervised by someone helps make the healing accessible. And so in bringing that idea into this model, I'm excited about the formation of spiritual, psychedelic, internships that can both offer the training and the skill sets, for spiritual practitioners to be able to be in this space, but then also make it accessible too, as well, for people who want to receive the help.
Hmm.
And again, not exactly sure what all that's going to look like, but that's
Hmm.
what I sense is wanting to happen, and I'm really excited about that.
Yeah.
Yeah.
Oh, sorry. Go ahead, Jeff.
No, you go right
I was gonna say one of the challenges is that folks are getting trained in a lot of these models, like through maps, for example, but there's nowhere people can practice yet because the legalization hasn't happened, or the approval through FDA for these medicines, and so it's great that a lot of people are being trained, but it's going to be a few years yet before people can be practicing. I forgot to mention that we're developing a post CPE fellowship. We have the CCSH fellowship, which stands for Compassion Centered Spiritual Health, but we're going to have some of our fellows their clinical focus will be psychedelic care. So for their fellowship, they'll get to be practitioners in these clinical trials. So that's exciting because they already will have had a residency in CPE.
hmm
So they'll already have some good chaplaincy skills and then be able to take this into the psychedelic context.
And one of the unique aspects up here in Canada is that as things are getting more and more legalized, we're realizing very few people are trained, or at least they're not willing to come forward and say that they're trained, and so the training opportunities are very limited. And I think one of the things that's in the conversation right now in psychedelic circles is the question: do you need to have a psychedelic experience in order to be a guide? And for myself, I tend to fall on the side that says, I don't think you need to have a psychedelic experience, but some awareness of mystical experiences would be great. I don't think we need to limit the range of experiences that people could have in encountering God to just psychedelic. I think we can be a little bit more open and expansive and curious about that sort of thing. But to connect to another part of the conversation that we were mentioning earlier, one of the things that's also legal up in Canada currently is medical assistance in dying. And it's been around for, a couple of years now. I want to say it's been about 4 or 5 years. And it's a pretty ingrained part of the Canadian healthcare landscape now. But we're just now starting to see how the structures that we have in place are very negatively impacting minority populations, people of color, people of lower socioeconomic status. There was a lot of press a couple months back of a particular case in Toronto where a woman pursued MAID because she couldn't find an apartment in Toronto. She had this condition that made strong cleaning chemicals very, very painful for her to experience. And that was the only thing they used in her apartment complex. And she couldn't find an apartment anywhere else. And so she went towards MAID and they approved it. Like that is a situation that's just hands down unjust. And palliative care physicians up here have always been pretty strongly opposed to medical assistance in dying, but they're also turning into some of the most powerful proponents of psychedelic assisted psychotherapy, because what they see as being a lot of the reasons people pursue medical assistance in dying could be something that's cured, like the demoralization that you were mentioning, Caroline. It's something that could be treated in ways that are a little bit provocative and maybe not orthodox, but it's better than pursuing death. And so there's a lot of hope and anticipation in that aspect, and we'll see how it goes.
Yeah, that's right. So the reminder, if you have a question, either put it in the chat or raise your hand with the little tool in Zoom to raise your hand, and we'll watch for that. Because we want to definitely answer any questions that any of you try to at least answer any questions that you all might have. I'm wondering, in the meantime, if we don't see anybody doing, let's see. Okay. Oh, so good. Thanks, Tim King. On our side of things, the next, our next month's forum is on November 30th at noon Eastern, and it'll be a chance for some of the other leaders from Ligare and the community that's gathering around us to hear what kind of where we've been in the last year or so, and where we as the leadership thinks it's going, and get input from all of you about what you need maybe in the coming year, what resources, what connections you might need, what we can provide to continue to grow this network of people around the world, but especially in North America and Canada, and then somewhat in Europe. So it's quickly expanding. The conversation around religion and spirituality is increasing dramatically in interest, and we've started a few little small groups that we'll do more of, but we'll want to hear. So November 30th, the link's there to sign up. So please, if you can, come to that, and we want your input, because this is an organization committed to serving the people that are interested in the topic of religion and psychedelics. So any questions, or people raise their hand? I want to hear from Caroline and Jeff about where you're seeing both, maybe first resistance in your professional, if you are in your professional groups, and then where you're seeing excitement and energy. And maybe Caroline first on that, just from where you're standing, where you're seeing resistance and energy.
I think the biggest, and I don't know if I would call it resistance as much as like non-awareness, but I think the biggest piece is that there are so many emerging trials right now, and so few of them have chaplains on them, which to me is like just mind-blowing if you think about the huge amount of spiritual experience as a part of psychedelic experience. So I think I don't really think it's intentional, but well, maybe in some places it is, but I think that a huge amount of work needs to happen in terms of advocacy for getting chaplains engaged. And one of the blessings and challenges of our communities is that we are sometimes we're all over the place. We have very, very divergent opinions and thoughts about how things can happen, and sometimes that slows us down. I see on our screen here that Steve Lewis is here, and he's a member of our network, the Psychedelic Care Network, and he's leading our efforts in helping some folks write competencies in relation to chaplains and psychedelic assisted therapy. But I think there are, Steve could probably speak to this better than me, but there are so many opinions on these things that it's going to take a minute for people to come together on what are the competencies of chaplains. So I think those are some of the challenges.
Okay. And excitement?
Excitement for me is that the healing power is here.
Mm-hmm.
I'm especially excited about the clinical trials relating to PTSD and MDMA assisted psychotherapy. I think that there are just so many millions of people suffering with PTSD, and PTSD is one of the hardest conditions to treat because of the avoidance element, and the fact that psychedelics can extinguish that fear component with the medicine. I think the potential for healing for people is so massive, and the results from these clinical trials are so, it's going to be a total game changer for the treatment of PTSD. So you can hear my excitement in that.
Right. Yeah.
Because I have I really think this is an issue of justice.
Mm-hmm.
Mm-hmm.
That people deserve good treatment.
Mm-hmm.
And if these modalities can offer good treatment, then we have a responsibility to make them available to people.
Yeah, a moral responsibility, right?
Yes.
Yeah, exactly. Jeff, and I do have a couple questions in the chat that I'll get to, but Jeff, where are you seeing the resistance, or if you are, and then what are you most excited about?
Yeah, I like Caroline, I don't know if I would term it as resistance, but I think the two things that come up for me that I think are a little bit at risk is the issue of equity, making sure that all persons can have access to this in a timely and effective way. And there are so, like, I have a Google alert that sends me an email every day that just searches for the word psychedelic. And it's that, I think that is the perfect example of where there's such an injustice and inequity right now, because in that news alert, it'll show me articles of pharmaceutical companies spending billions of dollars to get patents on psychedelics. And then right beneath will be an article about how 4 teenagers were arrested for growing mushrooms in their basement. You know, just the money that's out there that's trying to move and navigate things to their own interests, that's all happening right now. And I think spiritual care providers can come into that conversation as the prophets of old and say, hey, stop moving so quickly, notice what you're doing, seeing how this is going to impact people, and you know, calling them to their knees and telling them that they need to be true to who they are. Is, you know, hospitals are just as susceptible to that sort of stuff as anywhere else. So that's my 2 cents. But yeah, lots of stuff that's exciting too. You're seeing good work happening, more and more stories. I think it's just been in the culture so much more in the last year or two that people are starting to rethink it, and you're starting to see a lot of the walls break down. So that's exciting stuff.
Yeah, that's excellent. That's right. Let's Dennis has his hand up. Let,
Yeah, am I unmuted?
yeah, you are.
Okay, good. Okay. Yeah. I'm so pleased and excited about what's going on, and what's the discussion that's happening here. At the same time, I've got some real concerns and questions, and I think that I can express that by kind of having a condensed offering of my journey here. I was a 6 of 6 raised. We all came of age in the long 60s. So I had in the Bible Belt. When I was in college, I had a near-death experience, and basically my whole life for nearly 50 years has been curating that, which has included everything from, I was in pre-law, I changed to religion and philosophy, very intense psychedelic explorations as it was speaking to that. I eventually went back to school because I spent a lot of time in my own spiritual practice. I got a degree in religion, eventually MDiv. But I was always looking for a type of training that fit both my experience and what I wanted to, what I felt that I could offer others, and I never could fit. I remember I was at a school where you're ordained by Unitarian Universalists, and even the director there, which was a friend of mine, he said I was too much of a maverick for that. And I said, well, if I can't even fit in there, you know, then I go to a Buddhist group. They say you're not Buddhist enough, or a Hindu group, you're not Hindu, you know. So so then I decided to do some training with Integrative Psychiatry Institute. That's also does training for therapists with MAPS to be certified. And I do find in some ways that the psychology model is more accommodating for interspirituality or diverse spiritualities, but at the same time, not very well equipped to deal with spirituality. You know, so it's really, I guess what I'm throwing out there is that the type of training, I feel both like Jeff, you had mentioned the whole thing about the Roots that Thrive and drawing up on indigenous models. That's wonderful. Caroline, you mentioned the triad model of spiritual care practitioners working with mental health practitioners. I think those are two essential components in what we're trying to develop here. And I really feel it's what we're trying to develop is a training model that, Carolyn, you also mentioned, spiritual practitioners or chaplains might be familiar with spiritual and religious imagery. Well, a lot of the time you find within particular traditions or tradition specific, so to really be verse in imagery that comes from many different traditions, I think we're looking for a program or training that's not quite there yet. And I kind of just want to hitch on Simeon's thing in the chat. how can we really continue this or exchange learning formats, exchange what people's doing? I mean, this is a wonderful format here, but I want to take a full advantage of it with all the expertise and the experience that's before us.
Right. Yeah, that's right. And that's really what we're trying to figure out, how to do that in a way that's scalable, and we are working on it. And I agree that I look at the names of the people on here, and it's an incredible amount of wisdom already. So that is part of what we're working on. And it's probably smaller groups we can break into chat rooms or something, so we can do it across and some local things. And we've started to gather a group in Seattle. So where there's local interest and people can gather in person, with geographic specific, because Oregon, Washington, California, British Columbia, this is going to be happening legally sooner than it will be in Georgia, where I live, or other parts of the country. So although Texas is on the cutting edge. So like all these legal jurisdictions will have their own things. But so Dennis, thank you for that. And also to Simeon, because I think that's really an important part of what we're trying to do, is figure out how to get the right people together so they can share knowledge and wisdom. Spiritual directors, I think, are going to be important to this too, outside the clinical setting. And it's got its own set of trainings. And that's something, as an MDiv student, I didn't get much of. And I'm interested in what spiritual directors bring. And I see a couple spiritual directors on here that I know that are asking those same questions. So yeah, thanks. Did you, any particular specific question, Dennis? Or, I mean, thank you for your.
Well, I guess the specific question would be, for right now, what is there a training? What training in terms of a real interspiritual training that integrates, the psychedelics with the chaplaincy skills? Yeah, I think, Carolyn, I think that y'all are trying to devise something right now in Emory, but where with other people like me that are interested, the more I talk with people are interested, like saying, how can I be involved? And so where do I direct them? So especially if they need to, let's say that they don't have chaplaincy training, they want to go into the field, like what would we recommend?
Well, I do think the Naropa program, which I've been engaged in, is a really nice model, because I mean, it's the primary population so far has been therapists, but they also have acupuncturists and physician assistants and chaplains and physicians who are engaged in their training. And as part of the curriculum, there is an emphasis on spirituality. And one of the directors of that program is a chaplain who's been, creating the curriculum. That's Jamie Beachy. So there is a strong component of the spiritual material. The other piece that I like about that program is that there is a very strong emphasis on equity and justice. So that, I think, is something that persons engaged in spiritual endeavors hopefully are more attuned to. And so I think Naropa is doing quite a good job with that.
Well, and one thing in relation to that, in fact, I did work in grad school at the Center for the Study of World Religion there at Harvard, and actually it was Jamie a couple years ago, I guess, in the program that they have their own psychedelics and religion, and she had mentioned something about like I think she said the term therapists or chaplains without portfolios. There's a lot of people that have done their work kind of like out of the box. But then it's a matter of like, well, how to come back in such a way to offer your services in a way that people are going to feel safe and that you're well trained. And I mean, what about doctoral programs or postdoctoral I mean, people that actually want to go further and really realize that they're not going to be able to offer what they have to offer to so many people unless they've jumped through the hoops that people feel are required to feel safe.
Yeah. Jeff, did you have any thoughts?
It resonates. I think the biggest challenge that the field is having from my perspective right now is training programs. And there's a lot of them out there, and it's hard to discern what are the good ones and what are not. And it's partly because we don't have a structure that's out there that tells us what what we should do. We're even with Stephen, one of the conversations we have around competencies is we have this great list of competencies, but then where do we go with that? Who do we give this to keep us accountable to these competencies? That organization doesn't exist yet. I think it's going to be there soon. And there's a couple of different places that are vying for that position, but it's not there yet.
Good. Yeah, thank you. Yeah, it's emerging. Wanted to invite Tamara to ask a question. She has her hand raised.
Yeah, I guess I wanted to just jump off of the last speaker and just say, as we're talking about access, I think there's the question of access to the therapies. But there's also the question of accessibility for people being trained as practitioners, and a recognition that if the process becomes too onerous, what we do is we sort of encourage people working outside of established systems. And I think especially when we're dealing with something that has such deep roots in, as has been mentioned, certain Indigenous cultures, but also in the spiritual, and, often medicine holders having come from more being passed through women, when all of those requirements begin to pile up, who isn't going to have access to being able to offer these services, and figuring out what do models where there are just equivalencies look like? Is it having an MDiv? Is it a mainline denomination? Are there other lineage holders? How can the CPE process become something that's more accessible, right, to someone who wants to be a part of that? What we see in my denomination, the United Church of Christ, is often CPE is actually being dropped because it is so challenging for people who are at certain stages in life to move to a completely unpaid place to gain that training. But are there equivalencies? If someone has been in ministry for X number of years, do they have a chaplain equivalency? Or what are other ways to make it accessible? I think my concern is in trying to make it legitimate or palatable, I think we might overcorrect in the way of making it actually inaccessible. And so I just wondered if our two speakers might speak a little bit to that balancing act between making sure we're shoring up practices that are safe and reliable and trustworthy, while at the same time not sacrificing access and making it so that only certain people of certain socioeconomic or educational backgrounds will be able to be providers. I think that's it.
Yeah, good. Thank you. Thank you. Caroline, did you want to speak to that?
I think it's a really important point, and very complex. And I'm not sure if I have a really good answer or comments on it. I mean, it's just an excellent point. That again, I might be repeating myself, but that's one of the reasons why I really like the Naropa program. I mean, most of the people engaged in the Naropa program are women. There are many scholarships offered to people who are applying to be a part of the program, and they have a real eye to just equity in their learning structures. And I just think that they're setting a good example for what that can look like. But you're raising some very important points, and I think we have to just have open ears as we go along with this work.
Mm-hmm. Yeah, that's good. Thanks, Jeff. Do you have any? Thanks, Caroline.
Yeah, it's I think you're exactly right, Tamara. It's a challenge, and I'm encouraged in Canada that along the way that the federal government has been intentional in getting Indigenous partners to speak to it. I mean, just as an example, you look at some of the Indigenous cultures as they're training their medicine women. It's a lifetime. It comes from their community. It's not a 2-year degree program or a certificate. It's something that they're connected to a grandparent for decades and decades and decades and decades. It's and that, I think that speaks to the therapy too. It's not something that you go in as an outpatient and get a weekend trip, and then you're cured from your depression for the rest of your life. It's decades and decades and decades of work of integration and stuff. And so it does require a seismic shift in psyche for the westernized medical establishment to know how to do this right. And in a lot of communities up here, they're trying. So I think the points that you raise, I'm so encouraged that you've raised them, because that means that you're out there raising them in other places, and that's how the change happens. And I'm hoping that message continues elsewhere.
Thanks. Caroline, she did have a question in the chat. Does the Naropa program require 4 units of CPE? Is there?
No, they don't. It's
Okay.
because there's a lot of different, and I'm specifically talking about the certificate program in psychedelic assisted
Okay.
therapy. Mhm.
Okay, good.
And that program combines the NAPS training as well.
Okay, good.
Part
And
of
I
the
know
program.
the CIS training does require those 4 units of CPE, but I do know that there's also some flexibility on that, or at least I've heard that there is. I don't know that, but I've heard that there is. So it's based on application. So these programs have standards, and then I think are really, really interested in religious professionals getting the training, whether they're chaplains or clergy or spiritual directors, whatever they are. And so finding a program that works for you and then applying and just seeing what happens. UC Berkeley has a program now. Jeff's mentioned University of Ottawa, and Psychedelics Today, their program is called Thrive, I think, Vital. And so you can look at that, Psychedelics Today. I've heard really good things about their training. So there are other options out there, with Naropa leading the effort definitely in the spiritual part of this. So we really do want to honor the time. We set aside an hour and 15 minutes so that we can go a little bit over, and we want to honor that and sort of close up. Just a couple of reminders. One, the November 30th gathering will be a chance to hear a little bit from other leaders, not just my talking head, but other leaders within Ligare, about where we've been and where we want to go, and then get input from all of you about what you need. And we've gotten some of that today. So that's really helpful. There's the educators, the psychedelic educators for higher education. That's in the chat. And then Caroline and Jamie Beach's group, Transforming Chaplaincy, the psychedelics and chaplaincy. So those links are there. If those connect with you or your interest, please reach out to all those groups, and hope to see all of you in November on this, and contact us through our website, and we'll do our best we're pretty busy, and it's a pretty small organization right now, but doing our best to respond as quickly as we can. So be patient with us. I promise we'll get around to everybody. And thank you for showing up. Thanks especially to Caroline and Jeff for coming on today, and also to Tim and Garrett on our side of things to making this all happen. And we'll look forward to seeing everyone. Share the word, share our email list, and let's build this network from the ground up, which is what we're doing. So thanks again to everybody, and hope to see you in November 30th.
Thank
Peace.
you.